I understand that when it comes to healthcare and digital health startups, you don't like the word pilot. Why is that, and is there a better word for digital health entrepreneurs to focus in on?
And I think this is specific for many of us who started healthcare companies in the B2C realm, going to consumers and trying to do something for them. Mm-hmm. And often many of them have been moving into B2B, B2E, working with the big enterprise companies. In healthcare, the money is in three buckets. It's in health plans, health insurance companies, it's in the hospitals and the providers, and it is in the pharma. Those are the ones that own 80% of the $3 trillion today that we spend every year. So you have to go there and take those trees to make money. The money is not coming from the consumers because they don't pay anything directly. So you basically have to go to the big companies, and when you work with these big companies, we have experienced this a little bit, but we have seen, and I have seen many horror stories on the idea that, hey, let's do a pilot. Every big organization has an innovation team, and these innovation teams are there to work with the startups, with the new entrants, and do small tests. But very rarely those ideas and those early tests are leading into full implementations. So the pilot, it sounds like a doomed endeavor from the beginning.
Wow.
So you can do 100 pilots that might lead nothing in the end. So I try to just use the vocabulary and say, let's go from pilot to talk about proof of concept. If we already have something that works, let's do a small implementation in some market. Let's not do a pilot. Pilot means that we just do something little and try it, and it might not work.
Man, that's a good takeaway. I'm sure people are going to want to hear about that.